And today on At the Forefront Live, UChicago Medicine Comer Children's Pediatric Specialist will discuss epilepsy and epilepsy surgery during the COVID-19 pandemic. Are seizures in kids sometimes a symptom of COVID-19? Can epilepsy be diagnosed through a video visit? And do video visits work for kids with epilepsy? Dr. Douglas Nordli, Dr. David Frim, and Dr. Julia Henry will discuss when a child is a candidate for surgery, the different types of epilepsy surgery, and they'll answer your questions. That's coming up right now on At the Forefront Live. And we want to remind our viewers that today's program is not designed to take the place of a visit with your physician. And let's start off with having each one of you introduce yourselves to our audience and tell us a little bit about what you do here at UChicago Medicine. And Dr. Nordli, I'm going to start with you.
Okay. Hi, I'm Dr. Doug Nordli. I'm the Chief of Child Neurology here at University of Chicago. I'm an epileptologist, a specialist in epilepsy as well.
All right, let's go with Dr. Henry next, please.
Hi, I'm Dr. Julia Henry. I'm one of the epilepsy specialists here at the University of Chicago, and I'm the director of the Epilepsy Monitoring Unit.
Great. And Dr. Frim.
I'm David Frim. I'm the chief of neurosurgery here at the University of Chicago. I trained, though, as a pediatric neurosurgeon, and I've been working in the epilepsy here at the University of Chicago for about 20 years.
Great. All right, Dr. Nordli, we're going to start with you and just tell us a little bit about epilepsy care during COVID-19 and what's going on at Comer Children's and how can these this type of care be done safely, which we certainly know it is.
Yes, well, thanks for the question. And I should say, like, this pandemic's probably stressed all of us, but one of the good things that's come from it is this sense of pride that I have working here. You know, we were confronted with this challenge of how do we continue to care for our children with epilepsy, and the university stepped right up with the capability of doing video connection, so telehealth with our patients, and it's been fantastic. So the long and short of it is that we feel that we've been able to maintain excellent care of our patients with epilepsy thanks to technology and the resourcefulness and the compassion and the hard work of everybody involved.
You know, it's interesting, you mentioned the telehealth visits or the video visits, and I've heard some fantastic stories from various physicians, and we've received some really interesting comments from viewers and patients who have experienced these video visits, and they really like them. It's amazing how popular this has been, and one of the things that I hear over and over again is, you know, you don't have to wait in a waiting room, so that's nice, and you're in the comfort of your own home, and it's just a nice thing. And from a physician standpoint, I imagine there are some advantages as well.
There are, and just like this nice video segment that you're seeing demonstrates, is that we get to see the child in their home, moving around, playing with colorful things, you know, doing what kids should be doing, rather than sitting terrified in our office, you know, looking at the hammer or something. So this is so nice when you see segments like this of the child interacting, playing with the mother, and moving around the room. That's what we like to see him. And as neurologists, we're used to observational exams. This is where we derive most of our information, is watching these kind of segments like this.
That's fantastic, and I want to give credit where credit is due on this little video clip. I believe that was made by some of our med students. They put a couple of videos together for video visits so that people at home would have an idea of what to expect, how to prepare for them, and that sort of thing. So if you are interested in a video visit here at UChicago Medicine or Comer Children, just go on the website and you can watch that video and get more information about it. But the beauty of this is we want to make sure that people do get care that need care. Yeah. We don't want people to avoid care because they're afraid of coming to the facility because of COVID-19. So you can start with video visits, and then of course it's very safe once they get to the facility as well. There's a lot of things happening at Comer to make that happen as well.
Absolutely. You know, I think all of us here, we've dedicated our lives to the safety and well-being of the children that we care for. And so it's the highest thing in our minds. And so, yeah, we've really done a lot in terms of maintaining social distancing, like we're doing now, to wearing masks, to careful hand washing, screening patients, everything we could possibly think of. We met very frequently to go through all those, so we do feel it's very safe. And I think our experiences over the last month have illustrated that.
That's great. Dr. Henry, let's talk a little bit about surgery for children who do have epilepsy. When do you know that a child needs surgery?
As a rule of thumb, we recommend a surgical evaluation for any child who's had who continues to have seizures after trying 2 or more seizure medications. And so it's something to talk to your doctor about if you're still having uncontrolled seizures despite being on medication.
And Dr. Frim, you know, some of the stories that I've heard from various patients over the years, the seizures can be debilitating, but the surgery is almost, at times, or the surgeries can almost be like a miracle. What types of surgery options are available for children, and what do you see when you perform one of these surgeries that's successful?
So in general, we have to rely a lot on our colleagues from neurology because we have to use their data to guide what part of the brain is causing the epilepsy. Certainly, a lot of it that we do is taking out parts of the brain which have gone a little bit crazy and are making the seizure. Sometimes there's a lot of tissue that's causing the seizure, and we don't necessarily remove something, but we try and disconnect it from the rest of the brain to leave the healthy part working and the part of the brain that's making the seizures not really connected enough to anything to cause a seizure. There's certainly so many other techniques that we have to slow down seizure, to, again, disconnect it, and in some situations, use a variety of implants to try and reduce. All of those things are available, and the fact that in this pandemic has really affected our ability to do all these things with a high margin of safety.
That's fantastic. And Dr. Frim, you have a fan. We've already received one comment from a viewer that says Dr. Frim is the best. So you must have helped a family member there. That's nice to see. Dr. Nordli, when should parents seek surgery during COVID-19? Because again, I think there are concerns as to whether or not it's safe to come to the hospital. And first, we want to assure people that it is. But when should they consider that?
I think Dr. Henry started us off really nicely that whenever we're dealing with seizures that are poorly controlled despite trying appropriate medications, it's time to think of alternatives like surgery. And the thing that's special about children is that they're developing, their brains are developing. So in our minds, what's another concern of ours is that we don't want their epilepsy to interfere with their nice normal development. So aside from seizure control, the other times people should come to us and with some sense of urgency is heaven forbid, if they're seeing new concerns in how their child is able to perform or think or act. So those are our two indications, persistent seizures or regression of abilities.
Can you tell us just a little bit about, we kind of jumped into this quickly, but just about epilepsy in general and what is happening with the child or just a person in general that has epilepsy?
Absolutely. Maybe one way, Tim, you could think of it is that epilepsy is an abnormal flow of electrical activity in the brain. And as Dr. Frim was saying, the surgical treatments aim to either get rid of that source of the electrical activity or interrupt its flow. When that energy, that electrical energy is flowing, it basically stops the brain's ability to function normally. And so depending upon where that electricity is flowing will change the manifestations of the seizure. So our aim, as Dr. Frim alluded to, in better understanding a child's epilepsy is to figure all that out, figure out what kinds of seizures they're having, where are they coming from, and what's causing it, so that we can, it's a lot about tailoring the medication specifically to the needs of the patient.
And there's a significant range too with children that are suffering from epilepsy as far as how debilitating it is and the number of seizures even.
Absolutely. There's a very wide range from, seizures that are occasional and in older children to it's not unusual for us in infants to see some of our patients may have scores or literally hundreds of seizures in the course of a day.
Great. And Dr. Henry, when you get a patient, a family that comes in and to talk to you, how do you develop a plan for that child? Again, we just heard that there's a wide range here, so that's got to be pretty challenging, I would imagine.
Yeah, you're right. And that's a great question. The first step is really to understand what type of epilepsy we're dealing with and what type of seizures. As Dr. Nordli mentioned, there are some types that are benign, or we call them self-limited. The seizures can be certainly problematic when they happen, but they're typically easily treatable with medication, and we expect the child to grow out of it. And then on the other hand, we do have patients whose seizures are really impacting their day-to-day function and threatening their potential development. So getting back to how we come up with a treatment plan is we start there and use our EEG technology, which looks at the child's brain waves, as well as their MRI imaging, which can look for possible sources of the seizures, like some scar tissue or abnormally developed brain, that can tell us what we're dealing with.
And so with the children that you see, is diet important in all of this, along with the medications?
Yeah, so that's a really excellent question. We have some wonderful dietary therapies ranging from a full ketogenic diet all the way down to a modified Atkins diet or a low glycemic index diet, which are just less extreme versions of the full ketogenic diet. We know that those can be very effective for controlling seizures, especially if a child has difficult to control seizures and surgery ends up not being an option. But what we don't know is if there are more day-to-day things that people can eat or not eat to prevent seizures. So for now, it's pretty much either committing to one of these diets or just eating your regular diet.
We want to remind our viewers, so we'll take your questions for our experts. We have three of the best here today, so we're happy to take as many questions as you can fire at us over the next 20 minutes or so. Dr. Frim, can you tell us a little bit about some of the surgeries that you've performed and you've seen through the COVID crisis? Because really COVID has not stopped procedures or caring for children who have epilepsy.
So really, the COVID hasn't really interrupted much of our work, given the specific problems that many of these children have. Probably I could divide it into three general areas. Some of these children have epilepsy where we can implant something that would interrupt the flow of the electricity, as Dr. Nordli mentioned. And that works very well in many of the children, and certainly it's an operation that's not high risk and of significant benefit. And we've certainly been able to do some of that during the era of the COVID. We have done a couple of operations that are a little more complicated. One particular one had to do with removing some brain that was degenerating from a benign tumor that seemed to be causing the epilepsy. And that was the situation when we actually removed a significant amount of the tissue that was causing the epilepsy, and it more or less has disappeared. We also have had opportunity to do some of the disconnecting, if you want to think of it that way, where we've been able to leave the brain inside, but to disconnect it from the rest of the brain, which is working well. And that operation certainly went quite well, and that child seems to be doing well. So it's been a gamut of many things. Hasn't really slowed us down very much for the children that have significant problems that need to be dealt with in an expeditious manner.
And these are children, obviously, that you don't want to put off the procedures because they do need help and they need it immediately. Can you talk to us a little bit about the implant procedure? What exactly is that and how does that work?
So there's a variety of way of putting electricity into the brain in somebody who has frequent seizures, uh, and where there can be sensation of the upcoming seizure or some other behavioral changes, and the device can sense that and give the brain a little electrical shock in a sense, and that helps to stop the seizure or keep it from starting. And it's a simple procedure in many ways, but one that for many of these children can be very, very important in making them have a reasonable quality of life without the seizures being very bothersome.
That's interesting. Dr. Henry, can you tell us the differences that surgery does make in the lives of these children? I would imagine it's dramatic at times.
Yeah, it certainly can be. And if a child has a type of epilepsy that we don't expect them to grow out of and it's not well controlled with medication, then surgery may be their best chance of long-term seizure freedom. We know one way we refer to epilepsy surgery is the only real cure for epilepsy. While medication can suppress the tendency to have seizures, surgery actually, aims to remove the seizure source when we're actually doing a resection or ablation or a disconnection, as Dr. Frim was describing. And so while we typically leave our patients on their baseline seizure medications after surgery, there is the hope that if we've successfully removed or disconnected the source, that our patients can be seizure-free off medication long-term.
That's very exciting for parents, I would imagine. And Dr. Nordli, when we hear about growing out of seizures, what does that mean? I mean, you literally just age out of it?
Yeah, we use that term, but the way I think of it, Tim, is that I think that our bodies have some capacity to autocorrect for many problems, including the brain, and that there may be things that happen in the development of a child's brain that makes them susceptible to seizures, and as they mature, their brains learn how to adapt to that, and their seizures can go into remission, as Dr. Henry was saying. So this is very important, and why we have to know which type of epilepsy we're dealing with. When that doesn't happen, it can wreak havoc, and so it can be devastating. And as you were bringing up, when the child is a candidate for surgery, it can be completely life-changing. I mean, it can be the difference between a life of restrictions to a life that's unrestricted, and where you're literally can be off medication and leading a normal life. So that's the thing that I think fuels our passion for epilepsy work and epilepsy surgery, is that we've all seen that, and that's what we want for all of our patients. So we're very keen on evaluating people who may be good candidates for epilepsy surgery.
That's fantastic. So I have a question from a viewer. What is the optimal age for surgery in pediatric patients if they are candidates for surgery? And I would imagine, kids grow, obviously, so probably the brain changes as well. Not probably, it does.
Yeah.
But is there a specific age you look at?
In some respects, the younger the better, because the younger brain has a better capacity to adapt. We call it plasticity. So that if there's an area that's damaged and needs to be removed, then many times other areas of the brain can take up that function. So in many ways, the younger the better. If we're sure that the patient needs the surgery, Dr. Frim can tell us how young is too young, but typically it's in the category of around, what would you say, Dr. Frim, 4 to 6 months, I would say, although we've operated even earlier here, I know.
As time goes by, it seems that we can operate earlier and earlier, and quite have a good outcome in most of those situations.
Amazing. Are there special challenges, Dr. Frim, when you operate on a younger, smaller child? To me, it seems like it would be harder, but maybe not.
So the younger the child, we think the more robust they would be, going down even to infancy, because they're so able to regenerate a lot of things. that has to be measured, though, to everything being smaller and a little bit more delicate. Uh, there's tricks to operating at different ages, and that takes a certain amount of training to get that right and be able to understand the physiological differences between the infant and the toddler and the teenager and then the almost adult. And so over the years, we've been able to sort that out pretty well, and we tailor the operations in a sense both to the problem that's going on in the brain as well as to the age of the patient and their physiological abilities.
Very interesting. And Dr. Henry, here's a question from a viewer. By the way, Dr. Henry, you and Dr. Nordli are also getting shout outs now as well. I'm not trying to make this into a popularity contest, but we wanted to throw that out there. But here's a question from a viewer. How likely are seizures to reoccur after the surgery?
Yeah, so that's a very good question, and it depends very much on the individual case. So when we're going through the pre-surgical workup, we're taking in all the information from the EEG and the MRI and some of the specialty tests that we do to come up with an estimate of what we think the seizure freedom rates would be. And so we're often able to offer some different choices to families and say, we may do perhaps a more aggressive surgery and offer a higher chance of seizure freedom, or we could be a little bit more conservative, but the chance of seizure freedom goes down a little bit. But in any case, we're going to let the families know what their own individual chances are. In some of the best cases, when we're able to really pinpoint the source of the seizure and remove it completely, that can be upwards of like an 85% or higher chance of long-term seizure freedom.
That's fantastic. And Dr. Frim, here's a question for you from one of our viewers. They're curious if follow-up surgery is ever needed. Is that something that happens very often?
I think the number of surgeries depend a lot on what was causing the epilepsy. Oftentimes there are tumors that cause epilepsy, and then we need to deal with the tumor that sometimes reduces the epilepsy. Occasionally the tumor will grow back, and then it would be a second operation to remove that and oftentimes stop the epilepsy for that. Other times we have to stage procedures, either because of age or other things that are going on in the child's brain. And we do that for safety reasons and oftentimes because it's better tolerated in certain ways. So we try and tailor the situation to each individual patient. And obviously, one operation is better than two or more. But if the outcome's going to be better because of staging the operations, then that's probably the right thing to do.
Interesting. And Dr. Nordli, I know this obviously is a program about pediatrics, but as you mentioned that it's sometimes better to operate earlier, but as children age or even become young adults, is it still an option?
Absolutely. And another nice thing about working here at University of Chicago is that we work very closely with our adult colleagues in adult epilepsy, and so we have conjoint conferences where we discuss this. And yes, adults with epilepsy are also candidates for epilepsy surgery, and so we should never really give up hope that epilepsy could be cured. I think that's a very important point.
Interesting. Dr. Frim, I have another question that came in, and they're asking about side effects and recovery time for surgery. Can you talk to us a little bit about that?
So every patient's a little different, and every problem is a little different. And it's difficult to guess beforehand who's going to have a wonderful recovery and who's going to have a prolonged recovery. We're always hoping that it's a reasonable recovery depending upon what transpired. Sometimes a lot of the recovery has to do not so much with the brain, but the part of the surgery where we open the skin and we remove some of the bone that we would then replace. and that can cause a lot of pain, and it's not really uh, impacting what happened to the brain surgery. It's more the parts of the body that we've had to open up and then close. Uh, and sometimes it can be a very big operation on the inside, but the children fly through it because we have a small way to open to get to where the epilepsy is coming from. And then that can just be a breeze of leaving after a couple of days. It's really mostly what we're doing and what other things are going on with the child that would be important to know about if that question came up on a specific day.
Dr. Henry, what would you say to parents who may be considering delaying surgical options?
Well, first of all, I would say go back and talk to your epileptologist about the risks and benefits of it. If a child has infrequent seizures, maybe happening, once every couple of months, or go several weeks between a seizure, waiting another several weeks to get the surgery done may not be a big deal. But if you're having multiple seizures a day, that's really impacting your quality of life, and young developing children, it can hinder their development as well. So if you're worried about proceeding with surgery during this time, definitely talk to your doctor, talk to your neurosurgeon, your epileptologist, about the risks or benefits of either choice. We've been able to successfully perform some epilepsy surgeries here during this pandemic without complication, and as well as take care of children with epilepsy in the hospital, get them their EEGs, and get them their appointments as well.
We are getting several questions in, and we're near the end of the show, so I want to get to as many of these as we can. Dr. Nordli, how does the testing procedure work? And there's a second part of this question from the same person. Does brain damage on one side complicate or change it?
The testing procedure is usually not very complicated. Mostly relates to us examining the patient, reviewing imaging studies, and, as Dr. Henry was pointing out, using EEG, whether it's short duration or longer duration. Sometimes it's very valuable to record the seizures, and so it takes us a little bit longer time. It's
and you even said on the show before that sometimes you videotape, or a parent should videotape seizures.
Yes,
correct?
These new devices are amazing, and so we get so much information from parents recording the seizure at home. It's really helpful. So that's our main emphasis. And just as Dr. Frim was saying, like, each case is a little different. Damage on the other side, does not necessarily preclude you from being a candidate for surgery, depending upon where that damage is. So there many times the nuances are really important, as you brought up, and so it deserves careful consideration.
Does frequency or severity of the seizures, is that the main factor for surgery?
It's one of them. And the other one being the amount of disability that the seizures are causing. In essence, what we haven't talked about is that the ideal candidate for resective surgery, where something is removed, is an abnormality in a place that's completely safe to remove.
Yeah.
That's not going to impact function at all.
Interesting. And the final question, because we are out of time, does epilepsy increase the risk of catching COVID or increase the risk of complication from COVID for young children?
It's an excellent question, and our experience, thank goodness, in pediatrics has been very favorable here, and I would say the answer to that is largely no.
I feel like we had the lightning round here at the end. You're great, though. You rattled us off quickly, so that was awesome. You all were fantastic. That was really, really good information, and I'm sure helpful to parents out there. But we are out of time. That's all the time we have for the program today. We'll have another At the Forefront Live, of course, next week. Please remember to check out our Facebook page for our schedule of programs coming up in the future. Also, if you want more information about UChicago Medicine, take a look at our website at UChicagoMedicine.org. If you need an appointment, you can give us a call at 888-824-0200. And remember, you can schedule those video visits by going to the website. You can also watch that video that tells you how to do it. Thanks again for watching today, and I hope you have a great week.